In every battle that a child fights against cancer, there is a group of people behind them. Here are some of them. In our shoot, there were second takes, but in their daily work, there are no second chances. Whenever they meet a child with a life-threatening illness, they don't ask why, but where the pain is, to give each child a fighting chance.
I am from the Philippines. My favorite color is purple and blue. When I grow up, I would like to be a chef.
Can you imagine my daughter being open for 10-12 hours? That was very, very scary. I almost died. I mean, I also wanted to have anesthesia. I think I am more sick than Vanessa.
Do you eat salad?
Yes.
And how about you, cameraman?
Thank you.
How can I...
But just how sick is Vanessa? Brain cancer is the second most common cancer among children here. 3 out of every 100,000 kids are diagnosed with brain cancer yearly. Vanessa is one of them. The pain started in her tummy. She lost 10 kilograms within 6 months and was reduced to just 15 kilograms. The doctors in her home country said she was just suffering from anorexia nervosa. It was only after many consultations with different doctors and Melinda, Vanessa's mom's insistence for an MRI or a brain scan that they discovered Vanessa had a tumor in her brain. No one thought it was possible for an 11-year-old to have cancer.
The thing I like most being a pediatric doctor is to see children being children. Indeed, cancer affects children, although in a much less frequent manner. In general, the proportion of adult cancer to childhood cancer is about 100 to 1. So for every 100 cases of cancer we diagnose or seen in an adult, 1 case will occur in a child. So it is an infrequent illness, but it does occur in children, and they need to be treated as energetically as in any other disease of childhood.
Yes, hello Dr. Lee.
Hello, Dr. Lee.
Come in, please.
Good morning.
Good morning.
Good afternoon.
And energetically was the way Dr. Lee treated Vanessa's condition when she arrived in Singapore, because he knows that there is a high survival rate for children with cancer. The overall cure rate for child cancer today is about 75%. For every 4 children diagnosed with cancer, 3 of them are expected to survive to adulthood.
So Vanessa, you have to sleep so that by tomorrow everything is so perfect.
Yes.
Then we don't have to do the 4th cycle. Okay? Why?
She's gonna start sleeping now, see? How are you gonna bring her home? You're gonna carry her? She's gonna start sleeping now.
I did not hear.
Oh.
Number 1, people think that cancers are incurable disease, even though we are still in the 21st century. The second common misconception is children are so small, they cannot withstand the treatment of cancer. And we have a lot of standing testimonies to tell you that children are actually much stronger than adults in terms of withstanding the side effects of drug treatment. So this is important to know this because we need the child with cancer to come to treatment early and to receive the appropriate treatment that they deserve.
Doctors had to first get an accurate diagnosis of what was wrong with Vanessa. This was done through an 8 to 12 hour surgery on her brain. For Melinda, getting through the surgery was the most difficult part of Vanessa's treatment.
At 7 o'clock in the morning, we woke her up, and then the doctor put that sticker into her head, and at that time she wasn't talking. For so long she wasn't talking. She was only writing, she was only making sign language, and then she wrote on a piece of paper very nicely, "Mama, Papa, and everyone, thank you for everything." And then she signed Vanessa Guinea with a star, and then she wrote very big Singapore. It's like, what is this all about? You know, I look at my sister, she look at me, I look at my husband, we did not talk about it. After the surgery, that's the only time that we talk about it.
Melinda could not talk to anyone during that time, but she knew that whenever she was ready to talk, she had friends from CanHope nearby.
I'm inspired, by patients' words of appreciation, and encouragement. This helps me want to be a better counselor for each and every one of them. As counselors, we are there to listen, to provide listening ear, not only to the patients and even the caregivers as well, because caregivers also experience a tremendous amount of stress.
CanHope was started by Parkway Cancer Center in 2003 as a non-profit counseling and information resource service for those fighting cancer or who wanted to know more. Shu Sin and Nelly are part of the CanHope team, which provide practical helping hands to families like Vanessa and Melinda, who are not only seeking treatment but are away from home. They are registered nurses and are there from day one.
In the case of Vanessa, Nelly has been there to teach them about the particular skills, each set of skills, on, like, for example, dressing, feeding. There are things that, that might seem very small but very important to the parents who might feel very lost, in that sudden phase that the child is sick.
And they are there at every step of a child's treatment and even in times out of hospital.
She would bath Vanessa, she would brush Vanessa's teeth, she would do artwork with Vanessa, and she would come to our house and play with Vanessa because she knows at that time I was very weak. I was not really physically inclined to do things, and it's like I was so helpless. And so she was like my arm, my leg, and she was my spirit as well.
This is my consultation room. Well, initially this room is designed as a play facility. When a child is waiting to see me, they can actually pop in here to relax and to play. But I also find it to be very useful if I do my consultation here. The child will be much relaxed. Instead of tensing up his or her muscles, he will be very relaxed so that I can do a full examination to every part of his body and know what's going on.
Once the doctor ascertains what is going on in the child's body, there are 4 different treatments he can implement: chemotherapy, surgery, radiation therapy, or a 4th type of treatment called biological agents. And in some pediatric cancers, a combination of all 4 treatments are used.
My name is Anton, I am 16, I am from Ukraine.
Anton has a unique type of cancer, particularly present in children. It's called germ cell tumor. The cancer started in his testicles and then spread to his tummy. It was diagnosed to be life-threatening. The family was told by doctors over in their home country that the tumor had grown so large it enveloped one of his kidneys, and they suspected the kidney was dead. A string of bad news about Anton's condition followed. Anton's family did not want to give up hope, so they came to Singapore to seek help.
At least they have the needle this time.
Коли ми попали в Сінгапур, як то говорять, мамине відчуття, от серце відчуває, що от ці люди, це справді тобі поможуть. І я, будучи на Україні, постійно відчувала цей тиск. І от в мене хвора онкодитина, онкохвора, це як розслідування за мною було. Коли ми попали в Сінгапур, це взагалі щезло. Я не відчувала себе ні моя дитина іншою, ніж хтось інший. Ми були практично такі всі, наскільки ця обстановка, лікарі, медсестри робили для нас все так, щоб ми цього не відчули взагалі.
Natalia and Anton were told that this kind of tumor had to be treated by a multidisciplinary team. The game plan for Anton's treatment was to combine chemotherapy and surgery. The chemotherapy would reduce the amount of cancer cells in Anton's body to a stage where it could be then controlled by surgery.
As a children's cancer surgeon, the greatest joy is really to be able to see them function normally and be able to enjoy chocolates, games, toys, swimming, everything that all the other children can achieve. The idea of multidisciplinary treatment is really to use different types of treatment that we can to work together to the advantage of the patient. With the help of these treatments, we can also perform to a lower extent kind of surgery. We can actually reduce the complications of each type of treatment to the minimum. And who we are dealing with right now are actually children who have the potential of growth and development and a long life ahead of them.
The surgery on Anton lasted 12 hours. The aim was to remove the local disease that was still present in him while preserving all his vital organs and not cause injuries to them. When Anton woke up, the first thing he did was to move his legs, and he could. This meant he was not paralyzed. To everyone's relief, his kidney was also found to be still functioning.
I think Anton came with certain expectations that there's a hope, there's chance for him to survive here. I think throughout we were able to explain to him in detail every single step that we are going to take for him. He participated in the decision making, including every step as to what we were going to do for him, and it's only with his agreement that we will proceed with the steps of treatment for him.
The side effects of surgery could include bleeding and infections to other vital organs. Even though there are many potential side effects to surgery, it was the idea of being healthy again that gave hope to Anton.
Мисль, що буде все добре. От настроїв себе, щоб пройду операцію, щоб буде все добре. Там казали, що там може бути і параліч, що може бути мерло. Я себе настроїв, щоб буде все добре, що я буду рухатися, щоб буду ходити. І просто-напросто моральна настройка, сила волі. Що буде все добре, що я буду здоровий. Сказали, що буду здоровий. То я морально себе підстроїв, тому і давали мені такий драйв, що вилікуюся від того всього.
This was the same determination Vanessa had as she went through radiation therapy.
I am not afraid of the mass.
The mass is what Vanessa calls tomotherapy, or image-guided radiation therapy. With tomotherapy, radiation oncologists can check the location of Vanessa's tumor before delivering precise radiation therapy to her.
I love this work because I could help others in their journey, in their fight with cancer. In tomotherapy, the features are it can target the tumor very precisely, very accurately. And in order to do so, we perform a CT scan with her on a treatment machine every day, just before the delivery of radiation. This then is used to compare with the original CT scan. In that way, we know that every day the high dose is delivered into the tumor itself, and the other parts of the brain will receive much lower radiation dose.
The difference between conventional radiation and tomotherapy is that it will reduce the spilling of high-dose radiation to the surrounding normal tissue. The machine is able to precisely locate the tumor or target area before each day's treatment, thus allowing radiation therapy to be administered accurately and at precise dose intensities. General short-term side effects during the radiation, such as tiredness and loss of appetite, will usually go away between 2 weeks to 4 weeks after the treatment. But the long-term side effects of radiation are what doctors are concerned with. Each tumor site will present with different side effects. In Vanessa's case, tomotherapy would minimize their long-term side effects in terms of brain development, learning abilities, and growth stature. Combining other forms of treatment such as chemotherapy or surgery will help to reduce the need for radiation to be used in some cases. And in those cases where radiation has to be used, combining radiation with chemotherapy or surgery can decrease the dose and volume of radiation. It will help lessen the chance of getting long-term side effects.
When we treat children, we always bear in mind the age group. Now, we generally avoid the radiation for children who are less than 3 years old, especially if we are talking about radiation to the brain, because the brain is not mature at that time. We would often resort to chemotherapy alone to delay the use of radiation in these patients. Now, those patients who are above 10 years old, their brain is more mature, and so radiation of our brain, we tend to be able to deliver a slightly higher dose.
Mount Elizabeth Radiation Center is the first in Southeast Asia to offer tomotherapy. The first patient was treated on the 1st of March 2006. It is still the only center in this region to offer tomotherapy. This is the same machine used on Vanessa. The treatment itself is delivered painlessly. These days, Vanessa readily goes into the radiation rooms for treatment because of the familiar faces around her.
The first, I think, 2 or 3 days of the tomotherapy, that was really tough. Vanessa had to wear a mask. That mask is really tight, and so therefore, actually on that first day, we really had to force her. But then this Auntie Mango, one of the staff nurse there, she actually pretended to be the patient. Of course, Vanessa felt that she is the doctor, and then Auntie Mango is a patient. And then afterwards, Auntie Mango said, "Okay, Vanessa, now it's your turn. Can I do this on you?" And then from then on, Vanessa did not have any problem at all anymore. She's always looking forward to go to the tomotherapy and enjoy the nurses there. So that was a big help.
Everybody, see, I did it! Did it! Yeah!
Після операції стати на ноги. Після цього це було трудно, важко було, боліло, ну, боров себе, став на ноги, пішов.
In Anton's case, I think we were able to limit the incision to only part of the abdomen, and that actually has an advantage of having less pain and less discomfort during recovery period. And so he would be able to get up and walk and ambulate, mobilize much faster compared to other patients.
The estimated time of recovery from major surgery like the one Anton had been through is a week to 10 days. Anton was out of hospital in just 4.
When we told him that he was to sit up the next day, and he was there to say, "Yes, I'm going for it." And that gives the treating physicians and nurses a lot of confidence that you are dealing with a very motivated patient.
Chemotherapy has been used increasingly more often in treating childhood cancers for the last 20 years. It's helped increase the cure rate of cancers. Drugs now used in chemotherapy are more specific because of scientific research. Doctors are able to tailor the medication to be more directed to the cancer. Anton is now undergoing chemotherapy, which is part of the combination treatment plan to lessen the side effects of surgery. Dr. Lee believes Anton will have a 90% chance of beating the cancer.
Я дуже їм завдячна, і що вони спасли мою дитину і дали шанс на майбутнє, на життя, що ми не будемо відрізнятися від всіх інших, що в нас є і свої нирки, і свої судини, і в нас нічого штучного не поставили.
Okay, do yourself. Wow, 20.9. I'm happy.
20.9.
It's a good weight, so I will text Papa and tell Papa that you have a very good result for your... Yeah, the weight is okay. When she came in here, she was 14.5. So you can imagine, she was just skin and bone.
One sure sign that Vanessa was responding to a chemotherapy was that she started having the desire to eat soon after. She could also hold the food in her stomach for a long period of time for the food to be absorbed. She regained all the weight lost within 3 weeks of treatment.
Show them how to make your salad dressing. This is how to make salad dressing. First, I would need mustard. I only need a little bit of mustard. Mayonnaise. Pepper.
And how about this one?
Just a bit of fresh pepper. Not too noisy, please.
Oh, sorry. I'm sorry,
Just
Chef.
do it slowly.
Okay.
Relax. Don't be in a rush. Because if you're always in a rush, you might make a mistake. This is good.
When I see that Vanessa is responding to treatment, that was, I feel, sign of relief. That this cancer, it cannot put my daughter down. My daughter is so brave that she can beat the cancer, not the other way around.
And Vanessa can now regain her dreams of wanting to be a chef and doing the things she likes.
In treating these patients, we always consider their quality of life that's in the years ahead of him. And whenever we treat children, we always have this in mind.
Hope is like a flower going like this.
Hope is not just about hope.
Надія для мене це світло в кінці тунелю.
Hope is like having a better tomorrow.
The knowledge and the desire of wanting to live another day.
To have a dream and to realize the dream.
Having faith to carry on.
Моя надежда для меня уже сбылась.